Hello, everybody. My name is Frank Temple. This is my San Bernardino County COVID-19 presentation. Please enjoy. I'm going to summarize all my findings. So, the state police powers, state exercises their constitutional authority to protect public health, safety through mask mandates, business closures, school shutdowns, and quarantine orders. Federal guidance versus state autonomy. The CDC and the federal agencies issued recommendations, but the states decide what how to implement them, lending to different rules across the country. Funding and spending powers. Congress passed relief packages like CARES Act, rescue plans, etc., providing states with money to expand unemployment benefits, support hospitals, vaccines. Federal funds often come with conditions that shape states' responses. Devolution and decentralization, decentralized response. This here is directly from the San Bernardino County site. This is the welcome page. Devolution and decentralized responses. Empowering state and local governments. Devolution allows state and local governments to tailor their pandemic responses to their specific needs and context. Varied approaches. This led to a diverse range of measures implemented across different states and localities, from varying levels of restrictions to different approaches to testing and contact tracking. Local expertise and adaptability. Local authorities often possess unique knowledge of their community's needs and can respond flexibly, adapting measures to suit specific circumstances. Laboratories of democracy in action or lack thereof, opportunities for experimentation. The pandemic, with its inherent uncertainties, presented a potential scenario for states to act as laboratories of democracy, experimenting with different policies and learning from each other's success and failures. Lack of structured experimentation. However, the reality often fell short of this idea. Decisions were not always driven by structured process of experimentation and evaluation. Inconsistent federal guidance, the lack of clear and consistent leadership and guidance from federal level often left state navigating crisis with little coordination, future highlighting the challenges of purely decentralized approach during a global crisis. State level difference driven by policies in the US, differences in response were sometimes influenced more. Patriotism divides evidence based experimentation. Recognizing and addressing systematic racism, prioritizing data collection and reporting, equitable vaccine distribution. This is all addressing social justice, racial diversity, and equality in COVID-19 responses. With the COVID-19 pandemic, deepened existing inequalities within societies, particularly participating marginalization communities, raising a significant concern about social justice, racial diversity, and equality in the response to the crisis. Federalism meets the COVID-19 pandemic, thinking globally, acting locally. The federal government, through agencies like the CDC and the HHS, establishes overall testing strategies and requirements. They also secure supply chains for testing materials, provide technical assistance to states, and support the development of innovation testing technologies. Federal funding has been allocated to support state and local testing programs. S- State government formulate and implement testing plans that align with federal objectives while catering to the specific needs of their populations. They allocate funds for testing services and supplies, establish and operate testing sites, and oversee the capacity of their public health systems to conduct testing. Locally, local health departments play a key role in coordinating and performing health testing in their community, including COVID-19 testing. They ensure access to testing for all citizens, especially those in populations, and utilize testing data to inform public health interventions and strategies. To thank you for watching the presentation. Everybody have a wonderful night.